Sports are a part of many people's lives, and it is a common activity for people of all ages. From Little League to high school athletics, followed by college recruitment, and in some cases, professional athleticism, sports have the ability to influence the lives of some individuals. Unfortunately, with lack of care or sometimes simply due to unfortunate situations, athletes may become injured. Today, specifically, I will be educating you on athletic injuries surrounding baseball and softball and how you may work to prevent them. The article Pain on the Diamond describes some of the common injuries seen in baseball. Among these injuries, there's a rotator cuff tear, torn meniscus, elbow inflammation, and torn ACL. Your rotator cuff can be easily injured due to repeated throwing motions. This is because it's made of the muscles and tendons that stabilize the shoulder joint. This is an injury likely seen in pitchers and is almost season ending, and in worst cases, can even be career ending. A torn meniscus is also common in baseball and softball players. These tears occur when players pivot to throw, run bases, or slide into bases. This is because these movements cause hyperflexion or twisting of the knee. Some players are able to play through minor tears, while more severe cases require rest and rehabilitation. Baseball players are also susceptible to elbow inflammation. This is because repeated throwing motions cause chronic damage to tendons, and this injury also requires rest. This injury is also less likely to be seen in a softball pitcher because the softball pitching motion is more of a natural motion than the baseball pitching motion. Lastly are ACL tears. These tears occur from sudden stopping and pivoting. When this occurs, players can feel a popping sensation as the tendon rips. Most players require surgery after this type of injury. Some protective gear does help against these injuries. Sliding pants exist for both softball and baseball players to provide a kind of cushion when sliding into bases. Elbow guards also protect players when at bat, and catcher's gear is used by players who are catchers and squat behind the plate. Helmets and face guards in softball specifically also help protect against other head injuries. However, most prevention occurs through techniques, coaching, and training. UPMC Sports Medicine advises stretching before you begin any activity related to your sport. Going through simple stretches warms up your muscles and gets your body ready. Strength training and preseason and conditioning programs are also useful. UPMC advises against year round play and instead recommends programs that keep your body moving without adding additional strains to your body. Strains such as playing your full sport at full capacity all year. And finally, seeking help from professional athletic trainers and physical therapists can be useful. This is especially important if you've had an injury before or are recovering from an injury, as they can provide rational advice on how you can proceed and how you can regain your full motion and play your sport once again at 100%. Baseball especially is careful with injuries involving pitchers, specifically because in younger kids, specifically baseball pitchers, because again, baseball pitchers is less of a natural motion and puts more strain on the elbow. And this is seen how uh, in the younger years, kids have pitching counts, and this is to help prevent those elbow and shoulder injuries from occurring. For example, at the age of 15, it is recommended that a young pitcher only throws about 100 pitches at a time. And although this is in place to help pitchers, more protective gear needs to be accounted for. In baseball and softball, protective cups, mouth pieces, and other things aren't mandatory but can be useful in preventing these injuries. Sports are important for many individuals, and hence why it is important to know how to prevent these injuries so that individuals can keep participating in activities that they love.